Thyroid and the disorder called as thyroiditis. What is it? This is Dr. Chhaya Makhija, board certified endocrinologist and lifestyle medicine specialist. So let's look into it. Now, in general, in science, in medicine, itis is basically inflammation related to that particular organ or part of the body. So thyroiditis is a general terminology for inflammation of the thyroid gland. Now that could be because of multiple reasons. The most common cause is Hashimoto's thyroiditis, which is the most common cause for primary hypothyroidism in the United States of America. The other could be painless thyroiditis or something called as postpartum thyroiditis, which is a transient inflammation of the thyroid gland, and it may present with initial hyperthyroidism and then may get into hypothyroid phase and then into normal thyroid function test most of the times. So it's very important to track the thyroid hormone as well as treat the individual symptomatically rather than giving them anti-thyroid drugs. Other aspects are medication-induced thyroiditis. So medications like amiodarone, interferon can also cause inflammation of the thyroid, which will be termed as thyroiditis, but may have these exact same phases of hyperthyroidism, hypothyroidism, and normalization, or they may become hyperthyroid or hypothyroid. So hence, it's very important to follow or track these levels as well as patients' clinical symptoms to understand what would be the next phase of the thyroid disorder versus is there normalization. Now, if you have any doubts on what exactly is going on, there are certain tests which can actually help and serve as an adjunct in helping us as clinicians, as endocrinologists, to make a decision. And those could include, other than blood work, your antibodies, which are thyroid peroxidase antibodies for Hashimoto's, thyroid stimulating antibodies for Graves' disease, as well as there would be ultrasound, which helps us to indicate if there is increased vascularization, increased blood flow in the thyroid gland, which might suggest either thyroiditis or it might suggest Graves' disease. The other aspect is radioactive uptake and scan, which is iodine based, and it's a nuclear medicine scan, which is only done in individuals who have hyperthyroidism, and we cannot figure out a cause if it's thyroiditis versus thyroid nodules versus Graves' disease. So there are a lot of nuances I'm sure you've understood by the end of this video. Seek the right thyroid expertise. Get to an endocrinologist if you're dealing with constant fluctuations in your thyroid hormone, and follow along as I'll share more insights on thyroid gland.